I just wanted today to update folks on our progress around vaccinations and give you an update of where we believe we are vis-a-vis what you're hearing in some of the national media and some of the assertions that have been made by a number of organizations, individuals, elected officials, and the like, and give you a sense of where we believe we are and how we can make sure we distribute our vaccines and our protocols in an efficacious way, in a way that guarantees your health and safety. California today is launching now more formally a scientific safety review, a work group of 11 individuals, experts in their field. These are top health experts that will independently review any FDA-approved vaccines. Question I often get is, are you going to take someone's word for it as it relates to vaccines? Of course, we don't take anyone's word for it. We will do our own independently reviewed process with our world-class experts that just happen to live here in the state of California. Bottom line, though, is the first phases of vaccine will likely be limited in terms of availability. Questions abound. When do we anticipate or expect the first vaccines to be made available? There are some audacious stretch goals that you've been hearing that have been advanced out of Washington, D.C. Those stretch goals have been organized around two companies in particular that are asserting the availability of very limited supply of vaccines as early as November and December of this year. We have different protocols, processes, and procedures related to each company and their vaccines. They require different storage. They require different distribution strategies and plans. It gives you a sense that as every company comes forward, these happen to be from the CDC's assertion, the two companies that are leading in this space as it relates to the prospect of early limited availability, Moderna and Pfizer, that the number of vaccines will be very, very limited and require a protocol and a process of distribution focusing first on our essential healthcare workforce and our first responders. Accordingly, the limited first phase supply, and I'll in a moment give you a sense of what I mean by limited, also focuses on high-risk groups. Clearly, those 65 and over, those in skilled nursing facilities, long-term care facilities throughout the state, not only skilled nursing facilities, but residential care facilities, those with disabilities, those that are detained or otherwise incarcerated, and obviously those that are often underserved that have become higher risk from an equity lens, issues related to racial minorities in the state of California, particularly the Latino community, African American community, and never do we forget our rural communities in the state that often are neglected as it relates to the distribution of immunization strategies and vaccines. In this case, they're front and center in terms of our planning. So if I haven't lost you, I want to just, again, remind you that when we talk about vaccinations, don't anticipate or expect that you can go down to a local pharmacy anytime in this calendar year and likely get a vaccination. We hope that's the case, but based upon all the evidence, all the data that we have been provided and the expertise that we've been able to glean and advance ourselves in terms of the protocols that we have advanced with the CDC and the DOD as, again, one of 5 jurisdictions doing the micro-planning. It is simply unrealistic to expect that these limited doses will be for a limited number of people, and we don't anticipate mass availability until 2021. I want to remind everybody that vaccines will not end this epidemic overnight. The bottom line is, even if millions and millions of Americans, millions of Californians get the vaccination, get that second shot over that 21-day period based upon some of the earlier vaccines that we are aware will be made available. Again, there'll be many different strategies presenting themselves over the next number of months. These are the first few that we're working for planning purposes. It's not going to end this pandemic overnight.
Just to clarify, are you saying that no COVID-19 vaccine at all would be distributed in California, either through public health or private healthcare systems? until the state reviews and approves it?
Correct. We will review. That's why my advisory committee is up and running. They'll review the assertions. They'll make independent determinations of the veracity and efficacy of these immunizations, these doses.